This is the first of a two-part series on EEG artifacts. It is intended for the clinical neurophysiology fellows at Nicklaus Children's Hospital. The first part includes an introduction to EEG artifacts and eye artifacts. A brief initial section will be conducted in a conversational format. The second section will be conducted in a question and answer format. Artifacts can be defined as any potential difference due to an extracerebral source recorded in an EEG. There are certain clues that help us detect a possible artifact. They are activity or waveforms confined to a single channel, complex, odd-looking waveforms, waveforms with double or triple phase reversals, end of the chain activity in bipolar montage, similar activity in more than one non-contiguous head region, very fast, that is more than 70 Hz, and very slow, that is less than 1 Hz activity, and activity with identical morphology and periodicity. Here goes the first question. Artifacts can be classified in many ways, A true, B false. If you want to read only one article about artifacts, the one listed here is the one to read. It classifies artifacts in three main categories: biological, those arising from the patient; technologic, those arising from electrode-subject interface, electrodes, electrode connections, recording equipment, or display apparatus; and extrinsic, those that arise from outside sources as electrical lines and other devices capable of producing static electricity or magnetic fields or inductive and capacitance currents. There are, as you can imagine, many other classifications. Some classify artifacts as physiologic and non-physiologic, and they go from there. And there are certainly many others. But we will use the initially described classification to organize this talk. So the answer to this question is true. Next question. Dash artifacts are the most common biological artifacts found in EEG. A. Bioelectrical, B. Galvanic, C. Movement, D. Skin resistance. This major division, which are biologic, technologic, and extrinsic, can be further broken down and subclassify in many different subdivisions. I will start here talking about biologic artifacts. Biologic artifacts can be classified as bioelectrical, which are by far the most common of the biologic artifacts, skin-resistant artifacts, muscle potentials, and movement artifacts. So the answer to this question is A. Next question. The cornea is positive. A true, B false. One of the most frequent causes of EEG artifacts relate to the eyeball. It is good when thinking eye artifacts to think of the cornea as the positive pole of the eye and the back of the eye, the retina, as the negative pole. A second common cause of bioelectrical artifact is the tongue. The tip of the tongue is negative in relation to the root of the tongue that is positive. The third common bioelectrical artifact arises from the heart. The vector of the heart electrical energy is down towards the left leg, and it is negative at the right shoulder and neck, and it is positive towards the left thigh. So the answer to this question is true. Next question. Eye artifacts are not produced by A. Movement, B. Muscle, C. Corneal light interaction, D. Electrode light interaction. From our previous discussion, we can surmise that the eye can be viewed as a direct current battery, with the positive pole anteriorly towards the cornea and the negative pole towards the most posterior region of the retina. There is a relatively large direct current potential between these two poles. This potential persists, but to a lesser extent, even when the eye is enucleated. Usually, when the eye is enucleated, there's still some part of the retina that is preserved. Convergent eye movements can occur in many directions, as you can see in this frame. They can be slow or fast, and in each case produce an artifact that reflects the direction and the speed of eye movements. Direction of eye movement can be vertical, convergent vertical eye movements will bring the positivity of the cornea up or down. Lateral eye movements will move the positivity of one eye laterally and the positivity of the other eye medially. Up and out and down and out movements complete the repertoire of eye movements. These oblique eye movements are accomplished by contraction of different muscles in the different eyes. Looking to the right and up is accomplished by contraction of the lateral and superior recti in the right eye and the medial rectus and the inferior oblique in the left eye. Looking down and to the right will be accomplished by the right lateral and inferior recti contraction and the left medial rectus and superior oblique contraction in the other eye. But in addition to convergent eye movements, other types of eye movements produce EEG artifacts such as nystagmus, eyelid movements, blink, glass eye movements, and eyelid flutter. Eye artifacts can also be produced by contraction of the lateral rectus. The lateral rectus muscles are the extraocular movements most likely to be recorded by EEG because of the proximity of the electrodes to them. Another type of artifact related to the eye are those that occur because of interaction of light and retina. So the answer to this question is C. Next question. A rapid eye movement has a rise time of less than dash milliseconds. A 500, B 300, C 750, D 1000. This frame shows slow eye movements, indicated by the arrow. This one, fast eye movements. The distinction between fast and slow eye movements is based on the duration of the slope, that is the rise time, and the duration of the wave. The duration of eye movements is given in milliseconds. Ebersol classified rapid eye movements as those with a rise time or a slope between 20 and 200 milliseconds and a wave duration of less than 1 second. And slow eye movements as those with a slope or rise time more than 500 milliseconds and a wave duration of more than 2 seconds. A textbook on sleep disorders classify rapid eye movements as those with a slope of less than 200 milliseconds and a wave duration of less than 1 second. And therefore, by default, slow eye movements are those with a slope of more than 200 milliseconds and a wave duration of more than 1 second. Levin and Luters classify fast eye movements as those with a duration of less than a second. And as slow eye movements as those lasting more than 2 seconds. The Academy of Sleep classification uses or defines rapid eye movements as those with a duration of less than 500 milliseconds and slow movement as those lasting 500 milliseconds or more. Other classify eye movements, that is, classify rapid eye movement as having a rise time of less than 300 milliseconds. So the answer to this question is B. Next question. Take a few seconds to look at this frame and decide whether it's normal or abnormal the activity pointed by the arrow. Slow eye movements are usually symmetrical, but at times they are asymmetrical even without ocular pathology. Notice that they appear as out of phase in both sides, but not synchronized between the sides. Notice that the maximal and minimal phase reversals point on the left and the maximal and minimal on the right do not coincide. So the answer to this question is A. Next question. Interhemispheric derivations F7 to F8 attenuates slow eye movements. A true, B false. In this frame, the presence of a slow eye movement are difficult to ascertain. But careful look at this epoch will reveal a suggestion of it. But as you can see, creating an interhemispheric derivation using F7 and F8 makes it easier to see the artifact. Remember, the displacement of the eyes as recorded from F8 and F7 are not synchronized. So the answer to this question is false. Next question. A practical way to approach eye movements is to follow the cornea. A true, B false. A practical approach to map eye movements is to follow the cornea. When eyes are looking straight ahead, the positivity is to the front. When eyes are looking up, the positivity is up, forming an equator with the negativity at the bottom. In the right eye and in the left eye. When looking down, the positivity is down, also forming an equator. When looking to the right, the positivity is to the right in both eyes, each having their independent Greenwich meridian. When looking to the left, the positivity of each eye is to the left. Again, we can use the Greenwich meridian analogy to separate the positive and the negative field in each eye. When looking up and to the left, the positivity goes up and to the left, thus creating an oblique demarcation between the fields in the right eye and in the left eye. Each has a clear line of delineation, but this time the line, as we previously mentioned, is oblique, producing a positive field up and laterally on the left side, but on the right, creating a positivity up and a negativity laterally. Looking down and to the left will create a negative up and laterally in the right eye, and a negative up and a positivity laterally in the left eye. Looking up and to the right will create a positivity up and laterally in the right eye, and a positivity up and a negativity laterally in the left eye. Looking down and to the right will create a negativity up and laterally on the left eye, and a negativity up and a positivity laterally on the right eye. So the answer to this question is A. Next question. Which of the following derivations should be primarily used to analyze eye movements during regular adult EEG? A. FP1 to F7, B. F7 to FP1, C. FP1 to F3, D. FP1 to FP2. Most would agree that when analyzing ocular activity or when trying to detect eye movement, the best derivation are FP1 to F7 and FP2 to F8. So the answer to this question is A. Next question. When looking up, the derivation made between the frontopolar to anterior frontal electrode ipsilateral to the gaze will have an independent neutral polarity. A true, B false. Looking up, the frontopolar to frontal derivation ipsilateral to the side of the gaze will be neutral, here indicated by the 0. Looking down, the frontopolar to frontal derivation contralateral to the side of gaze will be neutral. So the answer to this question is true. Next question. Please take a look at this frame and choose from A, B, C, and D the best answer. When trying to determine the side of gazing, it is best to have an organized approach. The first step in this approach is to determine the direction of the deflection present at FP1 to F7 and at FP2 to F8. This figure will serve as a model to determine the direction of eye movements. In this frame, I have introduced the direction of the eye movement in their respective derivations. As you can see, the deflections at FP1-F7 and an FP2-F8 are down. This flowchart serves as a guide to drive the determination of eye movements from the derivations in the EEG. As you can recall from the question, eye movements were bilateral, symmetrical. The direction of the eye movement in both eyes were the same. And that direction was down. So the eye movements were going up. In this frame, I will go through a similar process. We're still in the same question. I will just do it slightly differently. FP1 is positive and F7 is negative. That's indicated on the side. On the opposite side, you can see that FP2 is positive in relation to F8. So, introducing a cartoon of eyes and electrodes and reproducing the field as suggested by our prior discussion about eye fields, since we know the cornea is positive, we then can surmise that the person is looking up. So going back to the master figure, we can incorporate the eyes to that figure, and the answer to this question is therefore A. Next question. Again, take a look at this frame and try to decide in which way the gaze took place. The possibilities are 4: A, B, C, and D. Both channels are going up. So the eye movements were bilateral, symmetrical. The direction of the eye movement is the same on both eyes, and that direction is up. Therefore, the person is looking down. In this frame, I am introducing a figure similar to what we have done in the past. In it, you can find the FP1-F7 derivation on your right and the FP2-F8 derivation on your left, and you can see their fields. Now, incorporating the eyes, as I have done in the prior question, and the suggested field, this would indicate that the eyes are looking down. Please take a few seconds to look at this frame and look at the polarities on the right and the left side of the screen. So now we go back to the master figure and we can incorporate the eye findings. We can, as you can see, the direction of the eye movements is down. So the answer to this question is D. Next question. Please take a look at this frame and decide what is the best answer. You have 4 choices from A to D. Stop the recording if you like to take a few minutes to answer this question. Going back to the flow eye chart movement, you can see that the movements were bilateral, as indicated by the arrow. They were symmetrical. They were towards the opposite side. That means the direction in the FP1 to F7 derivation and in the FP2 to F8 derivation was not to the same side. They were opposite. Then when we look at FP1, if you recall, in FP1 the deviation was down Therefore, the eyes are looking to the right. Again, I have introduced this frame just to show it to you in a different way. You can see the epoch, and on both sides you can see the representation of the deviation. On the right from FP1 to F7, as you can see, there is a positivity at FP1, and on the other side from FP2 to F8, as you can see, in this case the positivity is at F8. Now we introduce the eyes to the frame in order to show you that the direction of the movements were to the right. Here I have introduced the field, and I further have attempted to explain it by making sure that you understand that F8 is positive and FP1 is also positive because of the relation between FP1 and F7. FP1 is more positive than F7, whereas F8 is more positive than F2, but they are so by different degree of polarities. So now that FP1 and FP2 are neutral, since they see half the field corresponding to the positive cornea and half the field corresponding to the negative retina, as you can see indicated by the arrow in FP1 and FP2, this neutrality therefore contribute to the derivation in a way which is guided by the electrodes placed on the side, that is F8 being positive and F7 being negative. F8 will be positive because of the cornea, and F7 will be negative because of the retina. So going back to the master figure showing the direction of the channel deflection, which is on opposite direction, now we can introduce the direction of the gaze, that is to the right. So the answer to this question is A. Next question. Please take a look at this frame and choose from the 4 possibilities. Try to answer the question without moving to the next frame. Again, we start with the eye movements being bilateral, symmetrical, in opposite direction. Now looking at FP1, we can see that the deflection is up, which indicates that the person is looking to the left. Here you can see the epoch again that was in the question, flanked by the schematic representation of the eye movements with their polarities. The polarity here displayed is a consequence of the direction or the position of the cornea and the retina in the different eyes. and the interpretation made of that arrangement by the electrode's position. So this can be represented in this general figure as the eyes looking towards the left. So the answer to this question is B. Next question. Please take a look at this frame and choose from the four options to your right. The channel deviation is only on one side, so it is unilateral. If we look at FP1 derivation, we find that the deviation is down. Thus, the eye movement is up and to the right. In this frame, I have incorporated the epoch with the eye deviation, as you can see from FP1 and F7. Now I have introduced the polarity generated by such movement. On the side, I have placed the polarity at each derivation, and as you can see, in the FP1 it is positive, and in the F8 is also positive, but the F7 is negative and the F8 is positive. Therefore, the FP2 F8 derivation is neutral, whereas the FP1 derivation is positive. The arrow points to the equal polarity on both FP2 and F8, and at the FP1 F7 derivation, you can see that FP1 is positive, whereas F7 is negative. This pattern of eye movement, which is going down on FP1 F7 and neutral on FP2 F8, is, as we mentioned before, what occurs when someone is looking up and to the right. So the answer to this question is C. Next question. Please take a look at this epoch and choose the best answer from the four choices that you're given. Again, I am introducing the general flow chart. As you remember from the previous epoch, the eye movement was unilateral, and it was present at the FP2 derivation. And it was up in that electrode. Therefore, this indicates that the movement were to the right and down. Going back to the general figure, in this case, you can see that the eye movement goes up at FP2 and is neutral at F1, F7. Therefore, the movement as we previously mentioned, will be to the right and down. So the answer to this question is B. Next question. Look at this epoch and try to determine which of the answers is the best from the four choices. Again, we go to the flowchart. The changes that we previously saw in the epoch were unilateral, and looking at FP2, you can see that the deviation is downwards, which indicates that the patient is looking to the left and up. In this epoch, you can see the fields represented on each side. The positivity of the cornea can be seen up and to the left. Thus, both FP1 and F7 are positive, hence no EEG activity deviation is noted in that channel, whereas at the FP2 F8 channel, FP2 is positive and F8 is negative. Thus, in this figure, we can see that FP2 is down, whereas F1, F7 is neutral. Such a pattern is seen when a person is looking to the left and up. So the answer to this question is D. Next question. Look at this epoch and choose the best answer from the four possible answers. Take a few seconds and try to figure out before you go to the next frame. You can stop the video at any point. So if you go back to the general flow chart and you recall that the deviation of the channel was unilateral, also you can recall that it was present at FP1 and that the deviation was up. This type of eye movement presentation corresponds to the eyes looking to the left and down. Again, we see the second way that I've been showing this in multiple occasions. In this frame, you can see the epoch with the polarity on each side, and in addition to that, the eyes at the bottom representing the polarity, which in this case at the level of FP2 and F8, they're both negative, therefore this neutral, whereas the level of FP1, F7, FP1 is negative and F7 is positive. Now if we incorporate this in the figure, this becomes obvious, whereas you can see that at the level of FP2, F8 derivation, there is a neutral arrow, whereas at the level of FP1, F7 derivation, there is an upward arrow, indicating that the person is is looking to the left and down. So the answer to this question is A. Next question. Please take a look at this epoch and choose from the following answers. A. Horizontal nystagmus. B. Blink. C. Eyelid flutter. D. Vertical nystagmus. The activity in question is presented here shaded red. At the FP1 and C3 derivation and at the F2 C4 derivation, the activity is present, but it's also present at the FP1 T3 derivation and at the F2 T4 derivation. Now, if you look at the eye movement recording, you can see that the activity there coincides with the previously activity I have shown you. The activity is certainly more pronounced on the left than on the right. So if we go back to the flowchart, you can see in this flowchart that movements are bilateral, as we pointed out when we were looking at the epoch, but they are also not symmetrical. But as you can see in this flowchart, asymmetry on itself is not an option. The only option is very asymmetrical or unilateral. Therefore, in this case, you would make a judgment and consider this activity not to be very asymmetrical. And since there is no other option, then we have to call it symmetrical. So you can see in this frame the arrow pointing to it. Also, if you recall from the epoch that we just looked at, the deviation was towards the same side on both eyes, and it was up on both prefrontal derivations. So the answer to this question is D. Next question. Please look at this frame and choose the best possible answer. A. Horizontal nystagmus. B. Blink. C. Eyelid flutter. D. Eyelid fibrillation. Again, if we go back to the flowchart, we can see that the arrow points to bilateral, and that is because we were able to see the eye movements on both hemispheres. Yet the activity is very asymmetrical. Thus, following the chart, we must look at FP2, which was the derivation the activity was coming from, and since the deviation was up and down, to the right and down, and Now the arrow is pointing to the left and up. So the answer to this question is A. The answer to this question is arrived by elimination. The morphology of the deviations in the prefrontal lids do not look like blink, neither do they look like eyelid fluttering. And I don't think that eyelid fibrillation exists. Next question. Look at this epoch and choose from the possible answers. A. Right horizontal nystagmus. B. Left horizontal nystagmus. The fast phase of the nystagmus is to the right. Nystagmus are labeled either right or left when they are lateral based on the fast component. So the answer to this question is A. Look at the shaded area in this frame and pick the best possible answer. A. Eyelid flutter. B. Blink. C. Voluntary nystagmus. D. Frontal ictal activity. In this frame, I have enlarged the same epoch that I presented with the question. It is difficult to know the right answer in this question. I am certain just by looking at it that it's not blinking, because there is a blink just before and a blink just after, and it certainly doesn't look like blinking. Yet, which of the other it is difficult to say. You can also exclude the possibility of ictal activity, since you would expect that the ictal activity would also be seen during the blinking, which in this case is not. The answer to this is voluntary nystagmus. That is C. Next question. Which of the following descriptions is more likely to depict eye movements? A. A downward deflection at FP1, F7, FP2, F8, or both derivations that does not decrease in amplitude with posterior migration. B. Divergent deflections at F7 or F8, preceded by a small spike. C. An upward deflection at FP1-F7, FP2-F8, or both derivations. D. Convergent deflections at F7 or F8. The typical eye movement is largest at the frontopolar region and decreases in amplitude as it goes posteriorly. In the occipital derivations, it is hardly perceivable most of the time. If you notice at what I am pointing here with the arrow, and in this derivation, now I'm pointing to C4 to P4, and you can see that there it goes up instead of down. And the reason for that is that there was a mess up in the placement of electrode, and instead of going from P4 to C4, they went from C4 to P4, and therefore the signal would be inverted. In this frame, you can see an activity that is very characteristic of eye movements. I have enlarged the activity in this frame so it can be better appreciated. It is important to notice that the separation of the channels are preceded by a spike. This spike corresponds to a potential created by the contraction of the lateral rectus. So the answer to this question is B. Next question. Eye opening always produces an up deviation on the frontopolar derivation. A true, B false. In the classic description, which I am showing you in this frame, eye opening is characterized by an up deflection in the frontal lids and a cessation of alpha activity in the occipital lids. Here I am pointing to the same activity, that is to the eye opening, now on the right hemisphere. As you can see, it is usually bilateral, as well as the disappearance of the alpha activity. This is certainly the classic pattern, but by no means is the only pattern, and by no means is always present. Often we just get a slight biphasic type of activity. Sometimes it gets a little bit more biphasic, even starting to look triphasic. At times, yet is hardly perceivable. And at times, is not perceivable at all. In this frame, you can see the classic presentation of eye closing. It is a downwards deflection in the anterior most electrodes when we use a banana montage. Simultaneously, you will see that with eye closure, alpha activity will occur in the posterior channels, usually bilateral in normal people. Here is the typical presentation of eye closure, which is a monophasic wave going from anterior to posterior. Yet, this is not the only type of pattern that we see with eye closing. This is another view of eye closing. As you can see, the activity seems to be much larger than in the prior example. So the answer to this question is false. Blinking after complete eye enucleation produces eye movement artifacts on the side of the enucleation in the opposite direction from the artifact created by the normal eye. A true, B false. This epoch was recorded in a patient with an enucleated right eye. I have selected a blink in the normal eye and the simultaneous blink at the enucleated eye. As you can see, there is a small deviation in the same direction in the channels, reflecting the movement of the enucleated eye as in the channel with the normal eye. Yet the blink artifact in the normal eye is larger than in the enucleated eye in this sample. And in this new sample, as you can see, it is present in the normal eye, but is hardly perceivable in the enucleated eye. Yet, they are always in the same direction. So the answer to this question is false. Next question. Which of the following produces asymmetrical eye movements? A. Frontal skull defect. B. Oblique eye movements. C. External ophthalmoplegia. D. All of the above. Causes of asymmetrical eye movements include external ophthalmoplegia, oblique or tangential eye movements, as the many examples I showed you before, unilateral blinking, destruction of the retina. This frame shows you an example of a right ocular prosthesis producing asymmetrical eye movement artifacts. Another cause of asymmetrical eye movements are asymmetrical placement of the electrodes. And the last cause of asymmetrical eye movement is frontal skull defect. Remember that there is lower amplitude on the side of the defect. You can see this in this frame where the beta activity is higher on the side of the defect, but the eye movements are lower on the side of the defect. So the answer to this question is all of the above. Next question. Please look at this epoch and try to choose the best answer. A. Horizontal nystagmus. B. Blink. C. Eye flutter. D. Vertical nystagmus. The epoch which I am showing you shows slow alpha-like activity in the frontal lid that decreases in amplitude as it goes posteriorly. This is typical of eye flutter. Unlike nystagmus, eye flutter is smooth in both directions. This is another example of eye fluttering. Notice the drop of the alpha-like activity from the frontal lids to the occipital lids. This new epoch shows blinking initially, followed by eye fluttering. In addition, the arrows are pointing to EKG artifact, which when occurring at the same time of the fluttering makes it look like a spike and wave discharges. You can appreciate that association pointed here by the arrow head. So the answer to this question is C. Next question. Which extraocular eye muscle is most likely to produce frontal EEG artifacts? A. Superior oblique. B. Inferior oblique. C. Superior rectus. D. Lateral rectus. Here the arrow is pointing to the right lateral rectus. Here to the left lateral rectus. In this frame, I'm representing them in a cartoon to show you the position of the lateral rectus in relation to other muscles. I have represented the proximity of the electrode to the lateral rectus in this frame. So the answer to this question is D. Next question. The best electrode to see lateral rectus spike is A. T9, B. T1, C. FT9, D. TP9. In this frame, you can see a lateral rectus spike or multiple lateral rectus spike from F7 and also from F8. In this new epoch, the arrow is pointing to F7, and as you can see, this lateral rectus spike is quite prominent there, but the spike seems to be larger when recorded from the T1 electrode. It's also present at F8. And again, you can see it a little bit larger are at T2. T1 or Silverman electrode is not a 1020 system terminology. The placement of this electrode is close to the 1020 system terminology of F9. Here I'm representing the location of F9 in relation to the brain and to the eye. As you can see, the spike precedes a positive deviation in the electrode where the spikes are noted. You can see the same thing here. The one before was at T1. Here you can see it at T2. So the answer to this question is B. Next question. Please look at this epoch and choose the right answer. A. Electroretinogram. B. Blink. C. Eyelid flutter. D. Eyelid fibrillation. This frame shows sharp waves positive at FP1. This is present at FP2 as well. And again, we can see it here at FP1. This sharp wave corresponds with photic stimulations. These are electroretinal discharges. These discharges are better appreciated in this frame. You can see, pointed by the arrow, where the photic stimulation is, and just below it, you can see the response. Here, we're pointing to the response on the left, and here to the responses on the right. In this frame, I have selected one of the responses, and I have enlarged it in this new frame so you can see the waves and appreciate them better now that they are enlarged. As you can see, photic stimulation is followed by a brief negative wave, usually not appreciated at fast recording speeds. This wave occurs at about 10 to 15 milliseconds after the phoric stimulation. Following the first wave, there is a second wave, which is a positive wave, often labeled as B, which occurs 30 to 50 milliseconds after phoric stimulation. These waves are the result of retinal reaction to light. In this frame, I am representing the main cellular components of the retina. Now I have added the radial glial cells and astrocytes. When lights penetrate the retina and hits the choroid, it triggers a chemical reaction that is followed by an electrical discharge. This electrical discharge travels through cones and rods, and in its path towards the ganglion cells produces a recordable wave which is usually obtained or seen at any frontal deviation, in this case represented by FP1 and F7. The negative discharge is the consequence of the electrical reactions at the level of the rods and cones. The positive discharge that occurs afterwards, it is the result of a reaction at the level of the astrocytes. So the answer to this question is A. Please look at this epoch and try to decide the best answer. A. Electroretinogram. B. Photoelectric artifact. C. Eyelid flutter. D. Eyelid fibrillation. This epoch is an example of phoric trigger electrode artifact. Phoric stimulation is being done and a unilateral F7 artifact is present. This artifact is positive. And it is time locked to the phoric stimulation. As you can recall, F7 is one of the electrodes that we use to determine eye movements, direction. And it is in this case from F7, that is from a single electrode in the frontal region from which the activity is occurring. Some authors have explained the positivity of these discharges as a consequence of departing electrons. As you can see in this diagram, light acting upon the electrode dislodges electrons, which render the electrode more positive. This is another example of electrode artifact triggered by phoric stimulation. As you can see in this case, the positive artifact is arising from FP1. I find it interesting that, as you can see, the amplitude of the artifact provoked by stimulation at 6 Hz is taller than the amplitude of the artifact produced by stimulation at 8 Hz. I also find interesting that in an epoch published in Levin and Luthers, the electrode artifact triggered by phoric stimulation is negative. As you can see in this frame, there is a negative artifact arising from FP1 coinciding with the photonic stimulation. The fact that the artifact is negative is not consistent with the theory that explains the artifact as being the product of photon dislodging electrons. Another unusual feature in this epoch is the variability in the size of the responses. So the answer to this question is B, photoelectric artifact. Next question. Shading electrodes from light eliminates photoelectric artifacts. A, true, B, false. The main distinction between retinoelectrical artifact and photoelectric artifact is in their distribution. Retinoelectrical artifacts are bilateral, whereas photoelectric artifacts, I prefer to term them photoelectrode artifact, is unilateral. That is, photoelectric artifact are restricted to one electrode. Another distinguishing feature is timing. There is a delay in retinoelectrical artifact, and there's no delay in photoelectric artifacts. Another alleged distinction is that the amplitude of these two artifacts at lower frequency, let's say 5 flashes per second, becomes smaller in cases of a retinoelectrical artifact if the frequency is speed up significantly, whereas that will not happen in photoelectric artifact. I'd like to point out to you two things. Number one is that, as I showed you before, there is certainly a decrease in the amplitude of photoelectric artifacts, that is, artifact produced by light heating electrodes, when we went from 6 Hertz to 8 Hertz in the prior example. And I also like to point out to you that although we refer to photoelectrode artifacts as being unilateral, I really see no reason why they couldn't happen on both sides at the same time. But the distinction between bilateral and unilateral is very significant. So in the case of they being bilateral, perhaps they could be either a photoretinal artifact or a photoelectrode artifact. But in the case of being unilateral, there certainly are photoelectrode artifacts. I think that by far the most important distinction can only be made when the test is being done, and the way to do it is to chill the electrodes where the artifacts are arising from, and if they are photoelectrode artifact, the shielding of the electrode will prevent further artifact arising from that electrode. So the answer to this question is true. Next question. Which of the following is not true regarding photomyogenic artifacts? A, also called photomyoclonic response. B, occurs 50 to 60 milliseconds after the flash. C, most prominent at flash frequency of 4 to 6 Hz. D, most often observed in subjects experiencing alcohol or drug withdrawal. The same textbook that you can see in this frame uses two additional names for this event, that is for photomyogenic artifacts. This is an epoch that shows photomyogenic artifacts occurring with a frequency flash of 6 Hz. There is usually a delay of 50 to 60 milliseconds between the flash and the myogenic artifact. The maximal response to photomyogenic artifacts is when the flash is being flickered at 12 to 18 Hz. It is important to stress that the artifact ends shortly after the flash ends. That is, it should last just a few milliseconds after the last flash. Photomyogenic artifacts most often are observed in subjects with anxiety, Parkinsonal syndromes with blepharospasm, and those experiencing alcohol or drug withdrawal. So the answer to this question is C. Next question. Photic stimulation can produce artifacts by its impact in A. retinal, B. muscle, C. electrode, D. all of the above. This epoch shows an electroretinal artifact. I like to use the term photoretinal artifacts, but I have never seen anybody using that term. Now I have introduced a photoelectric artifact. This is due to the interaction of light with the electrode, so the term I preferred is photoelectrode artifact. Now I have placed a new epoch, and this epoch is that of a negative artifact arising from FP1 that is published as a photoelectrode artifact or photoelectric artifact in the literature. This final figure I'm introducing is a photomyogenic artifact. So the answer to this question is all of the above. Thank you.